webinar for free for you guys. So let's take it away. Let's see. So the reason why we're here today is we're going to talk about animal welfare. And more specifically, we're going to talk about animal welfare in the clinic settings. So what is it that we're trying to do in the clinic, and how do we actually improve animal welfare in the clinic? So this presentation here is not just specific for vets, it's for anyone who works in the clinic settings, but also anybody who's basically interested to learn about animal welfare. So let me introduce myself a little bit. I'm sure you have read a little bit about my bio. I'm right now what I call myself an animal welfare consultant. I do a lot of freelance work. Basically, I don't do a lot of exciting surgeries, not so much anymore. But what I do is I'm actually more like supervising, doing a lot of trainings. I work with a lot of NGOs, a lot of organizations to basically look at protocols, look at strategy, and how to make them better as well. And I'm also doing a lot of work with different organizations, like for example, veterinary organizations, Wasava, to actually put together guidelines and to actually incorporate animal welfare into a more day-to-day basis for all the vets around the world. I have a website. If you click on the link, it's going to bring you to a very simplified website. At the moment, it's just something, a holding website for my consultancy company that I've set up. It's called Animal Happiness. And also here's my email address at the bottom. So if you have any further questions, anything else you want to discuss with me, feel free to send me an email anytime. So enough about me. What I want to do now is to understand a little bit more about you and what do you do? Are you a vet? Are you a vet nurse? Or are you doing any other animal related job, or even non-animal welfare related job? So I'm going to put up here a little bit of a ABCD for you guys to vote. So let's see how many people are. What do you do? Great. See 10 people, 11 people voting. 15. Okay, and more people are coming in as well. Great. So that's it, 16 answers. Let's publish it anyway, so you can see what's everybody. So a lot of you here are vets. Some of you actually work with animals, not necessarily in a vet clinic, and a couple of you are actually just interested to learn more about animal welfare. Well, that's all good. I think we can learn a lot from each other, and we shall proceed. So one thing I would like to say here as well is that speeches that I do normally is going to be a little bit more interactive. So we want people to actually interact with us. Throughout the whole presentation, I'll be asking you a couple more questions every now and then, and hope that you're still awake, even though it's late at night everywhere in, for you guys, especially New Zealand, so far away. But yeah, it'll be interactive, so I'll be asking questions like this where you have multiple choice to answer, but also I would like to see hands raised, or give a thumbs up or anything if as we go along, so a little bit more interactive. So what I'm going to cover in this webinar, we're going to look at a little bit more in detail about what is animal welfare. And then we're going to look at how you can improve animal welfare in the clinic. So I'm going to give a little bit of tips. It's not going to be the only thing here. That's it. what I'm going to show you is just a little bit about how you can improve welfare in the clinic, and I'm going to leave you with some resources where you can actually learn more about how you can improve welfare. So it's a little tester, you can say, like a little bit of trying to understand what animal welfare is. And then before we end, we're going to look at the veterinary practice, the team, what consists of the team and their roles, and how everybody could improve on animal welfare. So what is animal welfare? I want to know how many of you guys here have heard of the 5 freedoms. Okay, yes. So you can answer online. Just click yes or no as you see the poll coming up there. You don't have to type everything into the chat box. So we can actually compile how many people here have heard of animal welfare. So for those of you who have just joined and missed out on the first few slides, the lecture series that I'm giving is a little bit more interactive. So we like to see people answering questions, and I will be asking you guys questions as we go along. So hope that you can see this and you can actually answer the questions. So look at the answer. 91% of you says yes, that you have heard about the 5 freedoms, and 2 says no. That's okay. I think even with me as training as a vet, and I graduated slightly more than 10 years ago, I would say during my time when I'm learning as a vet, I don't even learn about what is animal welfare. So to me, 5 freedoms is an alien concept. I don't know what that is. But as I work more in this field, I start to pick up on a lot of things, and then a lot of things comes to us. So a lot of us, we need to expose ourselves as we work along and as we educate ourselves. That's when we actually learn about what is animal welfare, rather than animal welfare being a very specific thing inside a curriculum. But I am glad to say that a lot of vet schools, especially here in Asia, have picked up on animal welfare and started to teach animal welfare. So I'm sure a lot of us here, 90% of you guys, have heard of animal welfare. I mean, heard of the 5 freedoms, probably based from your learnings or your own learnings, or maybe in vet school. But if you haven't heard of it, that's okay. So this might be the first time you've heard of the 5 freedoms. And what is the 5 freedoms? 5 freedoms is one of the first time that animal welfare really come up within scientists, within the science stream. So we look at scientists going out to measure people's concern about animals, and they think about, okay, right, people are concerned about animals, but how do we make it more scientific? How do we assess what is the welfare of the animals? So they came up with this concept called 5 freedoms. It's from the 1960s. So the first one is freedom from hunger and thirst. Second one is freedom from discomfort, and that usually means environmental discomfort. So basically, your environment where you're sleeping. Um, Next is freedom from pain, injury, and disease. The fourth one is freedom to express normal behavior. And then the last one is freedom from fear and distress. Now, since the 1960s, this has been used so many times, so widespread. It's very, very well known in a lot of places. But as more and more scientists try to use this framework to really assess animal welfare, they start to look at barriers and start to look at how this is actually a little bit more restricting. So the world with animal welfare scientists at the moment, we're changing from always using only the 5 freedoms to different types of concepts at the moment. So if you've heard of the 5 freedom, it's all right. It's still very valid. It's still very good basis to start learning what is animal welfare. So the next thing that I want to show you here is one of the reasons why animal welfare is a little bit more restrictive. So if you look, in fact, the terms that is being used: freedom from hunger and thirst, freedom from pain and distress. So those freedoms are actually talking about things here on the right. You're being free from something that is negative for that animal. So being free from something that is negative might bring you towards here in the center at the more neutral state. But that doesn't mean that you are actually enjoying life. That doesn't mean that you're actually experiencing pleasure or something positive. It just means you're not experiencing the negative. So freedom from hunger and thirst doesn't mean you're enjoying the food and drink that you're having. Freedom from pain and distress doesn't mean that you're actually experiencing pleasure. So here's a few concepts that I want to introduce to you. So if you're having a lot of more negative experiences in your life, um, the terms that now we are using, and it's very simple to understand as well, is called a life not worth living. And once you have overcome the negative experiences to a more neutral state. So, for example, if you have adequate welfare, so a lot of standards at the moment, you're talking about farm standards or a lot of standards of how animals are being kept. It's looking at an animal having adequate welfare. So, what is the minimum welfare you're looking about? And when that is achieved, when most animals don't experience that negative welfare, we call them a life worth living. But now the next stage of our role in animal welfare is to promote good welfare. So how can we make an animals experience more pleasure in life? How can we actually make sure that they have good welfare or what we call a good life? So here's some examples that you can hear when you talk about negative experiences. Some of these things you might hear, especially with animals, you might hear words like hunger, thirst, pain, overheated, fear, boredom. So these are all negative experiences, and it's more towards the left hand side. So the red area of a spectrum of animal welfare. And then on the other side of things, you have positive experiences. And this is where animals start to feel pleasure. And you can see animal experiences, for example, play, being affectionate, having reward, being comfortable, having pleasure eating, engaging with people and other animals, or even being calm, all positive experiences for the animal. So that's basically why five freedoms nowadays is not really used, very popularly used with animal welfare scientists. So what is the alternative if we don't have the five freedoms? Now there are several different frameworks out there that different scientists seems to prefer, but I'm going to introduce you today what we call the five welfare needs. These are a little bit more specific, especially when you're talking about dogs and cats, since we are talking about clinical experiences here, and it's kind of gives you an easier way of understanding what the animal needs as well. So five welfare needs. Um, it's actually based on the law in the UK, animal welfare law in the UK, where they prescribe what the five animal welfare needs of each animals. So therefore they can use this in the law to say if you're not providing this for the animal, therefore you're actually being cruel to that animal. So what is the five welfare needs? The need for a suitable environment, the need for a suitable diet, the need to be housed with or apart from other animals. So this obviously depends whether the animal is a social animal or more solitary animal. The need to be able to exhibit normal behavior patterns. The need to be protected from pain, suffering, injury, and disease. So I'm going to go through one by one some of these welfare needs and also how you can look to improve animal welfare in your clinic based on these welfare needs. Now, I know that in the clinic environment, basically a lot of clinics, the first and foremost goal for each and every clinic is actually this part of welfare framework. The need to be protected from pain, suffering, injury, and disease. So a lot of clinics are really, really focused in these areas. So how can you treat the animals? If the animal gets sick, how can you prevent it? How can you relieve the animal from suffering? How can you relieve the animal from pain? But if you go too much into it, a lot of vets, especially, like for example, my generation, when I graduate, that's all I was focused on. I was focused on the health of the animal, whether the animal has good health or bad health, and I forgot a lot about everything else. And that's what we are here to basically talk about. There are other parts in terms of animal welfare, and it's all interrelated at the end of the day. So if you don't take care of the lifestyle, of the welfare of the animals, it's going to affect the health part as well for the animals. So if you don't look at, for example, suitable diet for the animals, it can affect the disease in terms of what the animal gets later on. So we need to understand that yes, the goal of the clinic is definitely to focus on the need to be protected from pain, suffering, injury, and disease, but we also need to really think about all the other four animal needs as well. So that's basically what I'm trying to say with this slide. We look at animal, one of the needs, but we really need to think about all the other needs as well. And the whole thing will give you a better picture of what the animal's welfare is, whether it's only in the whether it's in the clinic or at home as well. So everything is interrelated nowadays. The need for a suitable environment. So things that we really need to ask with this animal welfare need is the animal in a comfortable environment? Is the temperature for the animal okay? Is it too cold or is it too warm? And a lot of times, like for example, if we have air conditioning, it might be cool for us, but it's not necessarily a comfortable environment for the animal that's recovering from surgery. So these are the small things that we need to think about to make sure that the animal's welfare is taken care of. Noise level. Have you ever think about noise level that the animal experiences? How about the ventilation in your area? Is the cage of the animal that you're keeping them, is it big enough for them? And big enough usually means at least the animal is able to stand up straight and stretch when it needs to. Is the cage that you're keeping the animal in, is it clean? Is it safe for the animal? And also think about the environment where the animal is transported to your clinic. Um, is the carrier that they're using, is it suitable for transport? So these are things that you can actually work with your clients to actually make sure that the welfare of the animal is good throughout the clinic and also at home. Now the next need is the need for a suitable diet. So some of the questions we need to think of is there clean water available at all times for this animal? Now I know you're thinking like, oh, if it's surgery, we need to fast the animal. But actually, if you look at the need for fasting for the animal in terms of water, and the risk that it's having, it's actually much better to let the animal have the water at all times, because dehydration actually causes the body to go out of balance very easily. So we need to actually be able to give them available water at all times. There's no real um, need to actually fast them from water. Some animals maybe, but actually most surgeries you actually don't need to. We need to think about what the animal is eating as well. So does it meet its caloric needs? Is it too much? Is it too little? Do your clinic actually have a plan where you actually sit down to calculate all the caloric needs of the animals? Sometimes I know that, especially in my place in Malaysia, I see a lot of people just giving the food to the animals, and a lot of times it's just too much. And in fact, some of the times, if the animal is sick, in fact, they fast the animal, they take away the food, and then becomes too little. So we need to really think about this all the time, and need to think about how you present to the animal. For example, a lot of cats, if you notice, they prefer a surface that's a little bit more open. So a more flat surface dish is more suitable for a cat compared to a dog. A dog, you can have a deeper bowl, especially those with long ears. Then maybe you can even have a deeper bowl. Frequency as well. Some people feed their animals once a day. Some people feed their animals twice a day. We need to think about this in the clinic as well. And hygiene of the food, is it prepared hygienically, is it stored hygienically, and if it's left over, how long do you leave it there before you take it away, or do you just leave it there until they really eat it all finish it all? So the other questions that we need to ask is, how soon can we return the animal to oral feeding? And actually, again, with animal welfare, the sooner the better. The sooner the animal returns to oral feeding, we know that they actually can recover much better as well. So after surgery, return them as fast as possible. In fact, with a lot of the neutering surgeries that nowadays I sometimes do, or some of my other vets do, I advise them is to return to oral feeding as soon as they wake up, because especially younger animals, when they get hypoglycemic very fast, they need to consume a lot more food, a lot more energy, and it makes them recover much better as well. So the sooner they get to eat. And how do we monitor them? How do we monitor this need for a suitable diet? One of the ways is we need to look at the body condition. Now, there's two things nowadays that people measure. One is the body condition score, that is how thin or how fat the animal is. And the other thing is, the second thing is we need to look at muscle as well. So we can actually have scoring in terms of muscle scoring. So how well built the muscle is. So for example, an animal can look like normal size, but if the muscle condition is very bad and it has more fat, then actually maybe the diet of the animal is not really suitable as well. So things that we can think about and start to assess in the clinic situation. And when we assess it, we can actually tell people how they can actually look at the animal's diet and plan it out um, in the long term. Now the next need to be housed with or apart from other animals. One of the easiest thing we can think about is, are dogs and cats kept separately in your clinic? Not just kept in terms of where you keep the animals in the wards, but do they have separate waiting areas as well? So I want to see, show of hands, how many have separate waiting areas for cats and dogs in your clinic that you work in. If you can raise your hands if you have separate areas. Yes, you do. Good, good. I see a few people.
Nat, I think some have just joined, so they may need to be sort of reminded how to raise their hands.
Okay. Let me go back to the thing. So we'll pause a little bit. We'll go back to remind people in terms of how they can join, how they can interact. So for the benefit of people who just joined, the presentation that I'm doing right now is a little bit more interactive. So if you have any questions, you look on your screen. This is a print screen of the webinar. If you have any questions, this is a field on the right hand side where you can type down your questions. So instead of using the microphone, feel free to type it down. So I will answer it as I go along, or I can answer it at the end of the session. And then on the left hand side, below the names of all the people in this room, we have 34 people in this room today. There's this little smiley face icon. So if you click on that, you can actually select different emotions, and I can see that you can actually raise your hand, you can give a thumbs up, you can give a smiley face, or if you really are feeling bored, you can actually do a thumbs down or an angry face. It depends on you. Great. So that's a brief chat about how to go about. So let's return to the presentation. So if you have a clinic that has separate waiting areas for dogs and cats? I want you to raise your hands. That is very good. So I see a lot of people actually, clinic is actually being very aware of the needs of different animals and have separate waiting areas. Um, Cats and dogs are very sensitive to smell, to noise, to sight, to pheromones that they can smell but we can't smell. So it makes a lot of sense for in terms of animal welfare to have separate areas, um, as much as you can, from the moment they enter your clinic to the time they go into wards, to the hospital, to the consult room, wherever, until they exit the clinic. So keeping them separately is actually good welfare for both cats and dogs. And some cats as well, they might be not used to other cats, so you need to think about the sociability of an animal. How are they interacting with other cats? How are they not, I mean, do they like it or do they not like it? So you need to think about that as well. You need to think about contact with humans as well. Some animals really enjoy that contact with humans, whether it's familiar humans or unfamiliar humans. And some animals only enjoy contact with familiar humans. So you need to think about all these things, whether they do or do not like. If they do not like contact with humans, then the best is to actually leave them alone, let them, have a place to hide, leave them alone and have as little contact as possible. Only contact them when it's really absolutely necessary. For example, when you're giving the medicines, or when you need to, assess something or check something or clean the wounds, for example. Think about all these things. Use of pheromones in the clinic is another example in terms of how to keep the animals more calm and more relaxed in the thing. So there are a few products right now available outside in the market, um, for both cats and for dogs as well. Some is and then in different formats as well. So some will be spray, some can be a plug-in, so it's a vaporizer thing, and I've seen products as well that now have embedded collars as well, and it works. It works very well. So you think about all these things, how you can use pheromones. For example, in your waiting room, you can spray some Feliway on the towels so that owners can pick up the towel to to cover the carrier while they're waiting to go into a consult. So animals, the other things we need to think about for this need would be to be aware about how animals associate aversive or even rewarding interactions with humans. So is that cat visit to your clinic, is it a pleasant experience or is it a not so pleasant experience for that cat? And if it's not so pleasant, how can we make it a more pleasant experience? So things like using treats, for example, especially with dogs in a consult room. So maybe a small injection for vaccination might be something that is really much less negative compared to the treats that they are giving. So it overall makes it a much more pleasant experience for that animal. And therefore, the next time we visit, it's going to be easier and easier to handle these animals. And for those of you who actually treat other exotic animals like rabbits, guinea pigs, or hamsters, for example, you need to think about what is the need for that animal. Is that animal social animal? So if you're going to keep it in the wards, is it better to leave it alone, or is it better to actually ask the owner to bring some of the friends so you can keep it together? Think about things like that. So my question to you here now is, in your practice, what do you use as cat litter in your practice? So we have A, B, C, D, E. So clay or wood shavings or something similar, or do you use only newspaper? Or do you use nothing, just a tray? Or you use nothing at all, so no tray and no litter? And E, I don't work in the clinic. Let's see. Start the polling. So for those of you who are answering onto the chat itself, if you can try as much to click the buttons so that we can actually um, count the number of people and count the percentage of people who answer A, B, C, D, or E. Great. We have 26 answers right now. Let's publish. So there, I'm happy to say that most of you actually use some kind of litter material in your clinic. Um, None of you use nothing at all. So at least you have a tray or some newspaper for the animals, for the cats to use. So one of the normal behavior pattern, one of the animal needs, especially for a cat, is to have appropriate toilets. And cats are much more picky with their toilets as well. So one of their need is actually to have something to dig, a substrate to dig, and to actually use it as toilets. So the best is actually some kind of litter material, and depending on the cats as well, maybe it's one of the things you can ask the pet owner, what type of litter material do they use, whether it's clay material, wood shavings, or some kind of other products that they commonly use at home. So ideally, A is actually the best answer, but providing something for the animals, whether it's newspaper, would be much better. I know personally some clinics who prefer to have nothing at all, or just maybe an empty tray. It's because they say that it's easier to clean, but actually it's actually bad, more, I mean, like, it's not so good for the welfare of the animals. So even if it makes you more convenient, it actually has an adverse effect for the animals. So these are some of the things where it's actually worth put a little bit more effort to make sure that the welfare of the animal is actually satisfied. So this is one of the examples that you can actually go to here at the bottom here. There's a link that you can download. So this is an example of low stress cat housing that is actually being advocated to different animal shelters in terms of how you can keep your cats. So one of the main thing is to have the sleeping areas, the eating areas, and the toilet areas. So these three main areas separate from each other. So some of you use a very small cage. Think of good ideas in terms of how you can actually make it a little bit more separate for your cat. Otherwise, your cat will be sleeping in a litter tray and pooing in the food bowl instead. So this is actually not so good welfare for the animals. The more separate you can keep it, the more larger space, even actually if you can give the animal, then the more like better for the animal to express its normal behavior. So some of the things you can think about, especially for cats, is a platform, a raised platform. So cats feel more comfortable at the higher level platform where they can sit up high and look in terms of what's going on around them. Cats really hate and become very stressed if they're kept at the low area, low, like ground, like floor area, where they have to look up to see things. That's because cats is more of a prey species, so they are actually feel very uncomfortable in that situation. So think about things like your, even like your waiting area, for example. Do you have table for your clients to actually put the the cat carrier or the cage that they bring the cat in onto the table? So these are small little things, like a little bit of a raised platform actually makes the cat feel more at ease. So having a raised area for them, something, having towels or some boxes or something where they, for especially for shy cats, where they can hide away and pretend you don't exist in their world. Those little small little thing releases stress from the animals, so they get less stress in these kind of places. And again, pheromones work, so you spray this kind of cages with Feliway, and it helps to calm them down as well. But think of other things that they experience, especially around what's happening around, is, can they smell dogs, the sense of smell? Can they see people walking around? And what about the noise level in the area where they are sleeping? I've I've even heard of some of the animal hospitals. They provide like soothing sounds in the ward area for the animals, because it makes them feel a little bit more calm. So small little things you can think about. And a lot of clinics I see, especially in Asia, are moving towards a more cat-friendly clinic. So if you can't provide like a big villa type cage for the cat, there are still a lot of small little things you can do to make it a little bit more comfortable. So things like putting its own cat carrier in the cage so it has familiar smells, and yet at the same time allows the animal to hide. And if it's a plastic carrier, then you actually have that little bit of height where the animal can jump onto a platform, and basically if they can look down on something, if they feel a little bit more safer. Soft bedding, so where the animals can sleep. So again, down here you can see the link here, and of course you can download this document, so you can actually go back and click the link tomorrow or the day after, and have a look at better examples of how you can actually make your practice more cat friendly. So that's for cats. Actually, for cats, there's a lot more need for cats, because a lot of people seem to think like, okay, it's going to stay here for a little while. Let's put it in a cage and let it recover. But there are small little things that you can do for cats. Dogs, not so much. I think dogs, a lot of people already giving to their needs. But let's cover it a little bit here. So again, the three areas, the sleeping areas, the food and water areas, and the toilet areas should be separate from each other as much as you can. And dogs that are being kept in a cage, uh, it's best if you can actually take the dog out to let it do its toilet, like having its toilet needs. If you have access to a street to let it walk, exercise, and stretch a little bit, that's good. If you don't, you still need to find a way to make a toilet area for the cats. So, for example, you can actually maybe put some of those pads in the toilet area, and then that becomes the toilet area for dogs. So taking them out of the cage, having the ability to stretch a little bit and go to the toilet, that actually seems to work a lot. I mean, like, it sounds like it's not much to humans, but actually for the dog, it's good for its welfare. Natalie, if you have a question, feel free to type it down and we will address that questions in a while. And again, for the dogs, if you're going to put it into the, you're going to put it into the, what do you call that? If you're going to keep the dogs in a cage, then you need to think about how big is the cage. Is the cage actually big enough for the animal to stand up, to stretch, to turn around, and to slide down comfortably? I know that a lot of times, especially while the animal is recovering from the surgery, it's being kept in quite a small area. So you need to think about how those animals can actually recover and actually can actually have much more space. So maybe during the recovery from the immediately after surgery, it's a small space, but then you need to think about their welfare needs and transfer it to a much better area. Um, Dogs actually appreciate a lot of bedding, so you can actually do uh, provide bedding for the animals. Um, Toys and giving things from the house also makes the animal a little bit more calm, because again, like I said, the sense of smell is very heightened. So if you have things or have its own toys from the house, towels, or even like the owner's t-shirt that they slept in for maybe 1 or 2 nights, you can provide it for the dogs. It helps a lot. It helps to give them that sense of familiarity. And of course, I think this is what we all do all the time, like keep it dry and keep it clean. And if you can, like I said, if you can take the animal out from the toilet and they know this regular time that you're bringing it out, then it's much more easier to keep it dry and clean. need to be protected from pain, suffering, injury, and disease. So this is where one of the things that we always do. We always want to actually, treat all the animals. But I want to ask you one question first. How do you think surgery affects the immediate welfare of that animal? So I give you this chart here to just think about whether the animal has a bad experience or whether the animal has a good experience during the surgery. So A, B, or C. And this is during the surgery. Okay, we're having a lot of people answers, a lot of answers coming in. 26. Okay, I think that's it. Let's publish and see. So a lot of you answers B, decreases the welfare, so it's towards the left, and I completely agree. Surgery actually induces pain on the animals, whether they ask for it. I mean, they don't ask for it, but it just induces pain on the animals. But however, the long-term benefits is completely a different matter, and we do surgery because we humans can think of the future, and for the future of this animal, it's much better for the welfare of the animals to undergo the pain now. But the animal doesn't experience it that way. The animal experience it now. What the animal experiencing is the welfare of the animal. So the animal experiencing pain during the surgery, no matter what kind of pain medication you're going to give, they might be able to feel something. And not just pain, think about the stress of handling. Think about how confused it is to wake up in a place that you don't know. This place is unfamiliar place. So a lot of the things that the animal go through during surgeries, and some a lot of times it's not just during surgery, it's during a lot of procedures, veterinary procedures, whether it's a checkup or a neuter surgery or an amputation or wound cleaning or something. All the procedures actually causes some kind of distress to the animal. So we need to think about, we really need to give what do we really need to do for the animals? Do we really need to do this procedure for the animals? Is it going to be worse experience for the animals now or not? And a lot of times we justify doing it because we can see the long-term effects for the animals. But we need to think about how we can minimize, if we think that thing is justified, we need to think now, how can we minimize what the animal goes through? So therefore things like giving it pain medication, giving proper anesthesia, handling it in the much low stress way as we can, are all things to do to minimize the negative effects of all our veterinary procedures. So we need to think of things like that. Um, and of course, in itself, we also need to think about how we can recognize the signs of pain. So it's just not just about doing it and giving pain medication, but are we doing it the right way? Is the animals, is the pain medication being enough for that animals? So we need to be able to recognize signs of pain, not just pain. We need to think about, how do we recognize signs of distress on that animal, signs of fear, signs of anxiety, and all the other negative effects that the animal can feel. So things like that we can think about. And a lot of times when the amount of suffering is very very bad, the amount of pain is very very bad, and there's nothing much we can do to medication to relieve that pain, or the prognosis of the animal is really really grave and we know that the animal will continue to suffer until it dies, that's the time when we actually need to think about things like euthanasia. So does your clinic have a euthanasia policy? If you have a euthanasia policy, raise your hands, I would like to know. That's good. A lot of clinics have a euthanasia policy. Excellent. So having a euthanasia policy in itself, even though if it's not perfect, nothing is perfect in this world anyway, helps to relieve the burden of actually making decisions for each and every animal, and also for your staff in terms of making decisions. So having a policy helps that, and it helps to actually be frank with the public as well in terms of what you will do for the animals, and and it's a very good thing overall. There are guidelines out there. If you don't have a euthanasia policy, there are guidelines out there that you can actually think about how you can make euthanasia policy. If I remember, I will try to find the guidelines and give you the link at the end of the talk. So Jeff has asked if there's any recommendation for a traffic light type of design for veterinary practices, and I'm afraid at the moment I haven't seen one for veterinary practices. We are developing a guideline through Wasava, just general animal welfare guidelines through Wasava, and we are actually looking at just kind of almost basic standards, something like this, that presentation that I'm giving right now. So we don't have anything specifically traffic light design yet, but it's a very good idea. So I will think about that. So if we can incorporate that, we will do it. And if I come across any traffic light design, I can maybe put it into the second webinar that we're going to do, which is next month. But thanks for that. Maybe something you can design yourself, perhaps? That's a very good question. The next few things, I just want to talk a little bit about a few other tips in terms of what can reduces the animal, promote good welfare in your practice. First thing is handling and restraint. Always think about when you're doing handling restraint, the goal is actually to minimize stress. So things that we can do, for example, is to use positive reinforcement or use counter conditioning. So if you look at the link here, you can see a video of how we counter condition these animals who are really doesn't like having its nail clipped, and just using a little bit of treats reward to actually making it a little bit more easier process for the dogs. Now, I know a lot of you are thinking like, I don't have time for this. And, training the dogs takes time. I would say yes. If you are never used to these kind of things in the first place, it takes time to actually learn, because you are learning, the dog is learning. But the more you do it, the shorter the time will be. And if you look at this video, they actually time it as well. The time it takes to actually counter condition the dogs to actually accept doing nail cutting is very short, much shorter than you would when you're struggling with the dog to restrain it to cut its nails. So look at the video. Next, a few other tips and tricks on handling and restraint is when you have a large dog, try not to lift it onto the examination table. So dogs, especially large dogs, if they are on a raised platform, they become nervous. So they're opposite of cats. And if your animal is on the table and it's facing one direction that you don't like and you want to access the other direction, for example, if you want to take a temperature, I know, and I'm guilty of this sometimes as well, is that I will turn the animal to the direction that I want. But actually, think about this, it's easier for you to go around the table and to actually assess that. It's much better for that animal. Um, for cats, try not to scruff the animal unnecessarily. I know a lot of practices immediately they scruff. It's like, oh, this animal will bite me. But try not to. Actually, the if you allow the animal time to adjust into your practice, while you're, for example, maybe if you're while you're taking history and talking to the pet owners, you can leave the carrier cage open so that the cat might come out by itself to actually explore what the surroundings is. And that's the time you actually, just positive reinforcement, touch the cat, reward the cat. And by doing things like that, like taking a little bit more time in the beginning, let the animal and calm down, let the animal have time to take its own time to approach you. You actually don't have to use a lot of force. So handling and restraint become much more easier, much more pleasant thing, not just for you, but also for the animal and also for your staff as well. So it becomes a much more pleasant place to visit, and the owner will think like, "Oh my God, this vet is amazing." um, so yeah, so some of the tips. And if you really need to restrain the cats, using a towel is much more humane way to restrain the cat compared to using a scruffing method. Um, Other tips would be try to recognize negative states for the animals. So if you look at this poster here, you can see the a lot of different signs in terms of how you can tell whether the animal is being anxious or being fearful. So some of the things that we miss would be, for example, maybe you can see the dog's eyes. You can see the picture here is perfect example. The eyes are wide open, so wide that you can see the white part of the eyes. That's actually a very big sign that the animal is very anxious. Lifting up of one paw, ears flat back. Sometimes with dogs, you can see signs, anxious signs, for example, licking its lips or licking its nose. Um, Yawning can be a sign of anxiety as well in dogs, especially if it's not tired. So these are small tips for you to look at and for you to actually take note what the animal is feeling. So question for you. Does your clinic use a pain score sheet to actually monitor pain? So it doesn't matter where the source is, but at least you have something to monitor the pain and give a score. Yes, no, but we will start soon, or I don't know. Okay, so we have 24 answers. Let's publish anyway. So we have quite a spread of yes and no and don't know, or don't work in the clinic. That's okay. I think pain scoring is not something that we automatically do. I mean, some of us will think like, okay, that animal's in pain, and okay, that animal is not in pain. But if we can, pain is something that we can actually learn to become what do you call it? Systematic in. So we can learn to actually score pain, like how we do with body condition as well. So there are quite a number of uh, pain charts outside there at the moment. So there's maybe the Colorado ones, or the one from Glasgow pain chart that you can use. At the end of this presentation, I will give you a link towards the Wasawa pain guideline. So they also have um, examples of how you can actually score pain, so you can read that more thoroughly. So there are ways to do pain scoring, and they do it with different methods. So you need to look at the posture of the animal, the look of the animal, what do you call it, the appearance of the animal. Let's see, you look at the appearance of the animal, you look at the posture of the animal, and then you approach the animal and see how it interacts with that approach. And you actually, if it's undergone surgery, then yes, you might need to actually touch the animal, palpate it a little bit, uh, poke a little bit. I wouldn't say poke, but you see how it responds to being touched. Especially near the surgical site. So all those are indicators within the sheet that will give you a overall indicator of the pain score. So you can have a look at different pain scores, and you can tell an overall thing of how the animal is in pain. So if the moment the animal is yelling and screaming in front of you, then yes, the animals might be in very, very pain, but there are a lot of subtle signs that you might miss. So if you're not being systematic, so if you have a pain score, you can start to use one, and you can develop something in your clinic that you can use. And it's not just for the vets, this is for your veterinary team. So you can actually start to teach uh, your vet assistant and the rest of them in terms of how you can actually approach pain. Um, so one of the question here is using doggy lifts for small dogs to cut nails. You have to, I mean, it sounds like a good idea, and I've seen the video where it's actually done quite well, but you need to think about um, things that create anxiousness in dogs, especially with big dogs, is having their whole body lifted off the ground. So if they cannot put their feet firmly on the ground, it might cause them a little bit of anxiousness. So it might be a good idea, but you need to look at the individual animal and see how they feel with having their body lifted off the ground. Uh, Even with small dogs as well. I mean, they are still dogs at the end of the day, and so we need to think about how they feel. So look at the poster before this one. There are lots of signs, and try to pick up things that would show you that the dog is being anxious, or dog is being scared of using that kind of mechanism to do cutting nails. So the last few slides I want to go through. I know it's been 1 hour already, but the next few slides will be quite simple, I hope, and fast. Just talking about the vet team. So it's not just onto the vets to actually manage the whole animal welfare, but it's the whole team responsibility for the animal. And within the team, you have people like vets, you have your vet nurse or assistant or technician, or doesn't matter what you call it. Different countries call them differently, and sometimes they have different ranks as well. You also have your management team, you have your receptionist, you have your cleaner. You might see a lot of other um, um, people in your clinic. So everybody plays a role in animal welfare. It's the main role of the vet, diagnose and treat animals, of course. But the vet, in terms of being a leader in your vet team, you need to know, you need to understand what is animal welfare. You need to know how to assess the welfare of animals. And once you have that knowledge, you can actually provide better advice and educate the owners in terms of the welfare of the animals, not just in their clinic, not just how to overcome that disease or sickness that the animal has, but if you see a problem with the welfare throughout its life, then it's something that they can actually try to better the welfare of the cats for the rest of its life. Vets and also the rest of the team can advocate for the animal, because obviously the animals can't speak, so we need to really always put ourselves in the shoes of the animal and think about how the animal is experiencing pleasure, or is it experiencing something negative throughout the stay of your clinic. One of the roles of a vet, and I think not a lot of vets step up to it, is join the veterinary community. If you join the veterinary community, you can actually voice out more for the animals, and then you can have a more collective voice to your government, to other stakeholders, to authorities, in terms of how others treat animals, or in terms of policy that affects animals. And all this is all how we can affect animal welfare more widely. In some countries, reporting animal cruelty might be a legal issue. So you might be responsible to actually start to report. And some countries doesn't have these reporting mechanisms yet, but I would say yet. So I think sooner or later all our countries would have. So we need to start recognizing, and we need to start thinking about whether to report or not to report animal cruelty, because there is the patient owner confidentiality, of course. And sometimes I think some of the answers would be just to talk to your owners about it. By just talking to them, they might not even be aware they're doing animal abuse. So sometimes just talking to them helps a lot instead of having to report them. Role of the vet nurse. Not many of us here are vet nurses, but actually, I think the role of vet nurses is coming up around in Asia. So a lot more people are choosing this as a career for themselves. We have a lot more um, people training to be vet nurse in a veterinary team in a veterinary practice. So I am seeing this career path growing, especially in Asia, and they play a huge role in animal welfare. Why? Mainly is because they provide direct care for the animals. They are the one who will feed the animals, change the bedding, clean the cage, provide what do you call that medication for the animals. And during all this time is the best time to assess that animal. Is it coping well in the clinic? Is it showing signs of pain? And you can see itself what the animal needs. So having that role of the vet nurse is actually very, very important for animal welfare. Sometimes they can do procedures if they are registered, and sometimes they are not allowed to do procedures. But the main important thing is how they provide for animal care. So the more vet nurses you have, train them how to recognize signs of distress in the animal, what they can do to comfort the animal in your clinic. Okay, we have a question about breeders. Let me address this at the end of the talk. Um, so I'll have one slide here just to let you know that, for example, with the role of the vet nurse, well, not just the vet nurse, vets as well, there are signs or there are ways to actually assess signs of pain in different types of animals. And one of the upcoming signs in cats is facial expression. Now, facial expression, you might think it's only a human thing, but actually it's not. It's being used at the moment to assess pain in mice, to assess pain in horses, and we are now, a lot of us are now developing it for cats as well. And for example, here you can see two different signs, the ears and also the muzzle area. So for example, the first row on the top, you can see like the first one on the left is a normal cat without any pain. Um, the next one is moderate pain, and the last one is a little bit uh, more painful. So same with down B is looking at the muzzle and how tense they are. The first one is normal, and the next two one is basically showing signs of pain. So things like this, if you keep on educating yourself, you can learn how to use facial expression in cats to measure pain. So things like that you can teach your veterinary staff, your veterinary team in terms of how to recognize. And it's always subtle signs like this that you might miss in a normal physical exam, but things like that, like your vet nurse when they're feeding the animals or when they're cleaning up the cage, is something that they can start to notice whether the animal is feeling okay or not. So a role of the vet nurse in the clinic is actually very, very important. But overall, the team, what else can you do for animal welfare? Well, first and foremost is basically engage your community. Animal welfare, not it's not just in the clinic, it's around us in your community. If you're having a lot of animal welfare issues, then you need to do something in your community. So engage with your community, do more community engagement, go out and participate in a lot more community activities. Advocate for animal welfare. Talk about animal welfare to your community. Talk about it with a lot of people, and speak up for the animals. um be a role model. That's one of the things. If you can't go out and do more, then in your clinic, be a role model. Action speaks louder than words. And if you can't tell people what to do, show them how to do. Things like how you handle the animal, it tells a lot to the owners what they should be doing for their animals. Gently speaking to the animal, handling them nicely, letting them have time to come out and get acquainted with the consult room, for example. Small things like that speaks a lot in terms of animal welfare, especially when you want to educate your clients. So that's it for my presentation today. In summary, just want to say that welfare is more than just animal health, and we need to constantly think of the 5 welfare needs for each and every animal from the moment it arrives on your practice until the moment it leaves your practice. Always think about how you can advise the owners on the pet's welfare needs, not just when it's in the clinic, not just about caring for the disease, but for the life of that animal. And advocate for animal welfare whenever you can, including outside your practice. Try to engage with the community and continuously educate yourself and educate your team. So that's all for today. The next page is basically references, so where you can get more information. Now, the cat welfare needs and dog welfare needs is a document from the UK government. I think it's very nice, very simple, and something that you can actually use it to talk with your owners with. And then you have at the bottom there Wasava's pain guidelines. Uh, this will tell you more about how you can how you can um, assess pain and actually what kind of pain medication to give. So it can be a little bit more technical. This might be a document for the vets. So looking at multimodal analgesic, for example, what kind of what kind of drugs can you do, for example, for routine surgery or castration. So that's all I have for today. Let's see the questions. So breeders, when it comes to breed standards, it's usually the the what do you call it, the kennel clubs that have all the breed standards. And I think in a lot of places in the world at the moment it's still a little bit more difficult to work with them in terms of getting the standards to a little bit more better welfare. I think this is um an upcoming animal welfare issue, and I think a lot of vets are trying to tackle it from by talking to the kennel clubs and how we can actually decrease the extremity of the different breeds in terms of looking at breeding the animal for the health as well as for the looks of that animal. um, how can we be a bit more diplomatic about it? I think it's going to be very difficult. I think the first and foremost is we can always use the health argument and saying that a lot of the breed standards are pushing towards having bad health for the animals, and we can have a lot of examples in terms of all the breed specific diseases that occurs, and we have a lot of data as well. There's a couple of projects out there that are actually collecting a lot of information in terms of the actual data diseases that the breeds have. So I think you can Google it out and look at the data in terms of animal health and what each breed is at risk of developing. So that's my advice in terms of how we can approach breeders. I think the health part, especially for vets, we have authority to speak on animal health, so we can actually use that argument. I hope that helps, Jeff. Okay, so anybody else have any questions? Feel free to type in, or if you want to speak on your microphone, raise your hands and we'll unmute you. So earlier on, I was talking about development of euthanasia policy. Um, so I'll put here the link to a how you can develop euthanasia policy guidelines, and it also gives um, what do you call that? It also gives you an example of how you make decisions on euthanasia, and I think it, yeah, I think that's it. If you look at the ICAM Coalition website itself, there's another document that tells you um, what is humane euthanasia and different ways of doing euthanasia itself. I think there should be a button here on below the slides that allows you to download the the presentation. So you can do that now and download it right now. Okay, Queenie, you have something to say?
Natasha, just wondered, in your experience of working with veterinary practices or perhaps in shelters, is everyone do everyone agree what animal welfare is? And if there was any sort of, an agreement, how can we get everyone on the same page?
I think in my experience, not everybody agrees what is animal welfare. Sometimes it's difficult talking science to non-science people as well, because animal welfare issues is very emotionally involved, and a lot of animal welfare issues is not just about animal welfare, it's about animal ethics as well. And animal ethics always fall in animal ethics basically means what is right and what is wrong, and we always confuse in terms of what the animal is experiencing versus what people want for the animals. So if you work in an NGO, a lot of times they don't they they put themselves emotionally out there in terms of what they think should be done for the animal. So it's very difficult to actually get everyone on the same page. I think in a clinic setting it might be much easier to do, because the the clinic itself, I mean, like, vets are very trained scientifically, and if you approach animal welfare in a science approach, you approach animal welfare in terms of how you measure what the animal is feeling at the moment, it actually is much easier to approach. So in a vet clinic, it will be much easier to actually teach people and train people and get them on the same page in terms of how they look at animal welfare. But in terms of what they think is right for that animal will be another question. It's very difficult to get people to understand what to do if they see animal welfare problems, which brings me to the next part of the webinar, where we talk about animal welfare issues and we talk about ethics as well. So how do we actually look at this problem, and how do other people look at the problem? It's not an easy question that you asked, like, Queenie. So I think Queenie, can we actually email everybody the PowerPoint slides since they can't
Yeah,
download it?
yes, of course. I've got everyone's sort of email attendance list here. Natasha, should we at this point wrap up? Or has anybody got any questions that they want to ask? If they want to raise your hands now.
Yes, we have two questions. One question here at the moment saying quality of life scale. There are different quality of life scales out there. If you just Google it, it's not, a lot of it is based on different practices and what they see rather than based on science. But I think using something as a guide is much better than nothing at all. So if you can use it, we have a question also. Let me read this first. So there's another question. Somebody is asking me, somebody is asking me about neutering males and whether this will prevent them from performing their natural behavior, which is basically mating. I think a lot of vets can answer you this in terms of mating behavior is actually um, uh, related to the hormones that's expressed, and it's actually the hormones that is making them want to do the mating behavior. it is, in a way, it is a natural behavior, but if you think about the risk and all the pros and cons of neutering, at the end of the day, does it help that animal or does it not help that animal? And a lot of times the argument is yes, it helps that animal, because you might stop that animal from mating. And in fact, if you take away the hormones when it's young and doesn't learn how to mate, then it doesn't know what it has lost technically. But also in the sense that by taking away the hormones, taking away the need to mate for the animals, the behavior is actually much better and in much better pet for the animals. So the relinquishing rate, the rate of animals being surrendered or being thrown away because of the behavior problem caused by mating is much decreased. So in that sense, yes, it is a much the pros is much more higher than the cons of doing what do you call it, neutering for the males. So I would say for me it's a definitely yes issue. I would say, I mean, yes to neutering males and not so much about causing it to not be able to perform its natural behavior. I don't think that animal knows what it's lost. I think that's it.
Thank you very, very much, Natasha. It's been a really wonderful seminar, webinar, and there's been a lots of ideas and to share with everyone. So I hope everyone can take it back to their practices, or some of you perhaps working in shelters. I know it's animal welfare. It's difficult concept often. And it's always good to have someone like Natasha bringing new ideas, reinforcing old ideas, and adding on new ideas for us to keep moving forward. So thank you very much, Natasha. Before we leave, I'd like to just let everyone know that this webinar series, so there are two at the moment, this one and the one coming up now has been awarded has gained CPE points from the Hong Kong Veterinary Surgeons Board. So if you log back into, I've just put up the link of the poster of the webinar, this webinar series. If you go back into the link, you'll see on the posters that we've added 0. With the each webinar has been awarded 0.5 CPE points. So please keep the poster. And what we'll do also is I've taken an attendance list as we went along, and we will be issuing you an electronic attendance certificate to match the poster. So in case this is something that you need to present to your organization or to your professional board in your country to show that you've been attending CPE. So thank you very much all for coming. It's been wonderful first session. We look forward to seeing you again in the next session, which is on the 2nd of May. It's a Wednesday, so a little bit 1 month away. And as Natasha briefly alluded and gave us an idea of what we're going to talk about. So she's going to bring the topic to a much broader base and also going to talk about ethics as well. And I think this is something everyone is dying to be, to want to listen and to participate in a discussion. So as usual, Natasha's webinars are very interactive. So be prepared to answer questions, engage, and ask questions. So thank you very much all for coming, and it's been a wonderful evening.
Yes, and thank you very much, Queenie, and thank you to everyone as well for attending. I think the questions that you guys have asked is very, very good questions, basically. So I hope to see you next month.